Well, one organization that has been at the forefront of combating polio is the international service organization, Rotary International. The organization is now looking to build on the gains recorded. Its president, Shekhar Mehta, is in Nigeria to boost the campaign. Bunariman Feintola reports.
The Rotary president is in Nigeria for a 3-day working visit. He has 3 main agenda in the country: to flag off a special polio immunization exercise, inaugurate projects targeted at the girl child, and meet with top Nigerian health officials on how Rotary International can assist the country in assessing more COVID-19 vaccines.
We are geared to work on vaccination along with the governments everywhere. I've been to 4 different countries, 3 different countries before coming to Nigeria. Everywhere we have given support that yes, we Rotarians are ready to support the government in any way that we can. Today I'm meeting the health minister here, and I will reiterate to them that Rotarians are ready to help. After all, we understand vaccine. For 35 years, we've done the vaccination work as far as polio is concerned. So we will be happy to help in the COVID vaccination process.
At this internally displaced persons camp in Abuja, the Rotary president inaugurated some of the handcraft made by young girls. Scholarships were also granted to some of the girls from primary to university level.
We decided to give the scholarship for this year to 20 girls, 21 as a matter of fact, because one joined this morning, 21 girls. These are girls from very, very poor homes. They are girls who want to go to school, but their parents cannot afford it. We are going to sponsor them from this primary school to the university level. So it's going to be our business for the Rotary, for our Rotary Club.
If we don't take care of the girl child, they will not be able to go to school. If we don't take care of the girl child, they will not be able to do their cause. And we are already stigmatizing them because of their nature. But we want a situation where people can encourage them, people can appreciate them, and people can accept them for who they are, so that they can go to school easily.
The organization says it is investing in the health and education of the girl child as a means of assessing many socio-economic challenges in the country.
The significance of this event today is to ensure that we take out young girls from period poverty to a point where they can be free from menstrual hygiene difficulty.
Nigeria has been certified as polio-free by the World Health Organization, and Rotary International says it is determined to ensure that polio does not break out again in the country by providing education, advocacy, and humanitarian activities in communities that are prone to an outbreak. Bunariman Feintola, Arise News.
All right, well, for more on this, Shekhar Mehta, the president of Rotary International for 2021-2022, joins us now. You saw him moments ago in that report. Thank you so much for joining us on Newsnight.
Absolutely a pleasure.
It was very troubling to hear that polio, though vaccination-induced polio, has resurfaced again in Nigeria. We heard it started in Adamawa, only to now realize that it's in half of Nigeria's 36 states. What exactly is Rotary's intervention in ensuring that polio does not go beyond where it is now?
So this is because of the places where there is no routine immunization. It's extremely important that routine immunization continues. Children will have to be vaccinated, and routine immunization will have to continue. You just saw some pictures where I had visited, and it is a center, primary health center, where routine immunization takes place. I saw children coming with their mothers, bringing them, and the immunization is being done. In far-flung areas where the routine immunization is not so strong, that is where vaccine-derived virus is emerging. It's not the wild polio virus.
Okay. What's the difference between
That's
the
actually
vaccine?
what I wanted.
Yeah,
to,
what's the
So
difference?
basically,
Help us understand.
the
Okay.
virus which is around in the air, and because of the feces of the children, etc., it can come to the other children, that has gone. It is then when the vaccine is given and the routine immunization is not very strong there, that's when vaccine derived.
I will ask immediately straight out, what will be the approach to nipping this? Because it's different, like we've gathered, from the wild polio. So what will be the approach to nipping it in the bud? And then maybe you should add to that the status of global immunization against polio?
Sure. So nipping it in the bud is absolutely the thing to be done, and what needs to be done is make immunization strong there in those areas wherever it is happening immediately, and we are attuned to, we know what needs to be done. WHO, Rotary, we all can come together there and ensure, strengthen the routine immunization so that it's nipped into the bud. That's one thing. About the global immunization scenario, I'm happy to tell you that when we started the campaign 35 years back, 350,000 children were getting afflicted each year. Last 7 months, no child in the world has got afflicted.
Oh, that's interesting.
That's great to know.
The last 2 countries, when we started, it was 125 countries. Now it's only in 2 countries, with Nigeria being declared, whole of Africa region got declared last year, so we just celebrated the first anniversary of that. 2 countries are left, Pakistan and Afghanistan. But I'm happy to tell you that for the last 7 months plus, not a single case in even Afghanistan and Pakistan has taken place. 5 more months, which will mean nearly an year, and we may have seen the end of it. So we cannot let our
guard down?
Yes, guard down. We'll have to be at it.
Great. Of course, I mean, polio is not the only thing Rotary International is concerned about. COVID-19 is very much here, and you've been talking about, helping out with COVID vaccines. What are your thoughts on vaccine nationalism that seems to be going on now, and what is the level of your assistance to Nigeria to make sure that Nigeria is not left behind as far as COVID vaccines are concerned?
So, when the first outbreak of COVID had happened, Rotarians came out and did whatever they needed to. Today we have forgotten that there was a time when people needed masks, they needed sanitizers, they needed PPE, and all of this was provided by Rotarians across the world. The next phase, it came oxygen concentrators at times were needed, ventilators were needed, strengthening of the healthcare system was needed across the world, and this is what was done. As far as Nigeria is concerned and vaccination is concerned, we have taken a policy at Rotary International that in every country, the Rotarians will work with the local government to see what is the help that the government may need. There are countries where there is enough vaccination, and there are countries where there isn't vaccination. There are, even in countries where there is vaccination, there is vaccine hesitancy. So what we have suggested is, we understand vaccine in comparison probably a little better than the others, having worked on vaccine. Cold chain needs to be maintained, etc. How we need to create awareness about it, how to get people, when there is vaccine hesitancy, how to convince them that, yeah, you need to take the vaccine. Vaccine is important. Vaccine works, is what we are telling. So that is a very important aspect. One is availability of vaccine. That, of course, the government will have to work on. Because it has to be purchased and the government will have to purchase. But even when it is purchased, it's not a guarantee that everybody will come and take the vaccine. There is going to be vaccine hesitancy. Awareness will have to be created. People will have to be told it's important that you take vaccine, otherwise you can suffer. And we see, if you see on television, even in places like America where there is so much vaccine, but there is vaccine hesitancy. So Rotary will play a big role there, especially in vaccine hesitancy and creating awareness that yes, people need to take the vaccine.
All right, but not particularly helping to get the vaccines in. That's not your turf. Yeah, but just take this question along the line anyway. Why are you from the video? Why are you so interested in the girl-child education? I mean, it's quite interesting because they were even talking about sanitary pads there. What is your advice for Nigeria on girl-child education? Any assistance from Rotary International for Nigeria?
Absolutely. In fact, the reason why I talk about it so much is that each year the president of Rotary has 1 or 2 focuses. The focus that I have presented is empowering girls. So across the world, we are talking about empowering girls, and it has been seen that even in today's time, girls are discriminated, disadvantaged across the world. I feel girls are half the humanity, they should have half the opportunities. So it's important that we create opportunities. If they are disadvantaged, we have to take extra care for them. We have to ensure that their girl child does not drop out of school. So dropping out of school is one. ensuring that they keep continuing in their school. It's very important. Like they say, you educate a boy, you educate a boy. But you educate a girl, you educate a family.
All right.
So it's very important that we ensure that the girls are definitely educated.
All
Let's
right,
hope you
we'll
can
leave it
actually
there.
intervene with-
Shekhar
yeah.
Mehta, the president of Rotary International for 2021-2022. Thank you so much for being
Thank
on
you
the
very
program.
much.
All right.